What are the latest advancements in aphasia research? Imagine a future where stroke survivors with aphasia can regain their ability to communicate more effectively. Recent research is bringing that future closer by exploring innovative ways to boost recovery. Scientists are focusing on neuromodulation techniques, which involve using electrical or magnetic stimulation to influence brain activity. When combined with traditional speech therapy, these methods aim to enhance the brain's natural ability to reorganize itself, a process called neuroplasticity. One of the most studied approaches is transcranial direct current stimulation, or TDCS. This technique applies a gentle electrical current through electrodes placed on the scalp to excite or inhibit specific brain regions involved in language. Early studies suggest that TDCS can provide modest improvements in speech and language skills after stroke. Researchers are still figuring out the best ways to use it, like where to place the electrodes, how strong the current should be, and how long sessions should last. Some trials are even testing home-based TDCS supervised remotely, which could make treatment more accessible. However, it is important to note that TDCS is not yet approved by the Food and Drug Administration for aphasia treatment, and more research is needed to establish standardized protocols. Another promising technique is transcranial magnetic stimulation, or TMS. Unlike TDCS, TMS uses magnetic fields to stimulate specific areas of the brain with greater precision. Researchers are exploring different TMS protocols, such as intermittent theta burst stimulation, to encourage the brain to reorganize and compensate for damaged language areas. TMS is often used alongside speech therapy to improve outcomes, especially in cases of post-stroke aphasia. Beyond neuromodulation, behavioral therapies like mirror neuron system therapy are gaining attention. This approach involves observing and imitating actions to activate neural circuits involved in both movement and speech, potentially strengthening language pathways. Advanced brain imaging techniques such as functional magnetic resonance imaging and diffusion tensor imaging are also playing a key role. These tools help map individual brain networks affected by aphasia, guiding personalized treatment plans. They can identify the most critical regions to target with neuromodulation and track how the brain reorganizes during recovery. Researchers are also working on integrated multimodal approaches that combine neuromodulation with evidence-based speech therapy. Some innovative systems are being developed to adapt stimulation in real time based on brain activity, which could make treatments more effective and tailored to each person. In the case of primary progressive aphasia, a neurodegenerative condition, clinical trials are testing combined therapies to slow language decline and improve quality of life. These personalized approaches use brain imaging to determine the best stimulation targets based on each patient's specific subtype and brain changes. Understanding neuroplasticity, the brain's ability to rewire itself, is central to these advancements. It highlights that even after damage, the brain can reorganize and find new ways to support language. This knowledge is helping shape rehabilitation strategies that maximize recovery potential. For stroke survivors with aphasia, these developments mean more individualized and potentially more effective therapies. While no cure exists yet, combining traditional speech therapy with neuromodulation offers hope for better long-term communication outcomes. It is always essential to consult healthcare professionals for personalized advice, as each person's recovery journey is unique. Ongoing research continues to refine these techniques, aiming to make them safer, more accessible, and more effective for everyone.